Imagine trusting a seemingly helpful AI to guide you on something as essential as your diet, only to end up in the hospital with a serious case of chemical poisoning. It sounds like the plot of a sci-fi thriller, but it's a real-life cautionary tale that underscores just how much care we need to take when relying on artificial intelligence for health advice. This isn't just about one person's mistake. It raises critical questions about the role of AI in our lives and whether we're prepared to handle its limitations responsibly. And here's where things get concerning. This incident could easily happen to anyone who doesn't fully understand the risks involved. At the center of this story is so he asked ChatGPT for alternative options, expecting safe and reliable suggestions. What he got instead was a recommendation that would prove dangerous when taken literally. The AI suggested replacing sodium chloride with sodium bromide, a compound that might sound similar but is anything but harmless. Sodium bromide has historically been used in medicine as an anticonvulsant and sedative, but today it's primarily found in industrial applications such as cleaning agents, manufacturing processes, and agricultural products. While it's fine for non-consumable purposes, ingesting sodium bromide can lead to severe toxicity, a condition known as bromism. Yet without fully understanding the implications, the man followed through with the substitution for 3 months. By the time he sought medical attention, the effects were alarming. He reported symptoms including overwhelming fatigue, persistent insomnia, poor coordination, facial acne, cherry angiomas, small red bumps on the skin, and extreme thirst. These are all classic signs of bromism, which occurs due to prolonged exposure to toxic levels of sodium bromide. But there was more. The man exhibited paranoia, claiming that his neighbor was trying to poison him. To make matters worse, he began experiencing auditory and visual hallucinations, leading hospital staff to place him on a psychiatric hold after he attempted to flee. Doctors treated him with intravenous fluids and electrolytes to flush the toxin from his system. They also prescribed antipsychotic medications to address his mental state. After 3 weeks of close monitoring, he recovered enough to be discharged. However, the experience left researchers and healthcare professionals deeply concerned about the growing reliance on AI for personal health decisions. In their case study, published in the Annals of Internal Medicine, the authors highlighted a sobering truth. This case also demonstrates how the use of artificial intelligence, AI, can potentially contribute to preventable adverse health outcomes. They pointed out that LLMs are designed to predict sequences of words based on statistical likelihood, not to evaluate facts or exercise common sense. Without human oversight, these tools can produce recommendations that range from misleading to outright dangerous. But here's the part most people miss. Because AI conversations are dynamic and tailored to individual inputs, there's no way to reconstruct exactly what ChatGPT told the man. Each interaction builds upon previous exchanges, making it nearly impossible to pinpoint the precise advice given. The researchers noted that it's highly unlikely a human doctor would ever suggest sodium bromide as a substitute for table salt during a consultation. Human practitioners bring years of training, contextual awareness, and ethical responsibility to their recommendations, qualities that even the most advanced AI lacks. Dr. Jacob Glanville, CEO of Centivax, a biotechnology company based in San Francisco, weighed in on the issue. He stressed that while AI systems like ChatGPT can be powerful tools, they should never replace actual doctors. These are language prediction tools, he explained. They lack common sense and will give rise to terrible results if users don't apply their own judgment when interpreting the output. Dr. Harvey Castro, a board-certified emergency medicine physician and national speaker on artificial intelligence, echoed this sentiment. He reminded us that AI operates by predicting word patterns, not verifying facts. ChatGPT's Bromide blunder shows why context is king in health advice, he said. AI is not a replacement for professional medical judgment. Yet, despite these warnings, the regulation of AI in healthcare remains murky. There's currently a regulation gap, according to Dr. Castro, when it comes to using LLMs for medical information. For instance, while regulatory bodies like the FDA ban substances like sodium bromide for human consumption, those restrictions don't extend to AI-generated advice. Global standards for overseeing AI in health contexts are still undefined, leaving room for misuse and misinformation. Adding another layer of complexity, LLMs can suffer from data biases and a lack of verification mechanisms. If the training data includes outdated or niche references, the model may generate inappropriate responses. As Dr. Castro pointed out, current LLMs don't have built-in cross-checking against up-to-date medical databases unless explicitly integrated. This means that even well-intentioned queries could yield dangerously inaccurate answers. To prevent future incidents like this, experts are calling for stronger safeguards. Dr. Castro advocates for integrating specialized medical knowledge bases into LLMs, implementing automated risk flags, and combining human expertise with AI capabilities. He believes that with targeted improvements, LLMs could evolve into safer, more specialized tools. However, without proper regulation and oversight, rare but consequential cases like this one are likely to recur. So, where does this leave us? Should we abandon AI altogether when it comes into contact with our health? Or is there a middle ground where technology and humanity can coexist safely? OpenAI, the creator of ChatGPT, has acknowledged the stakes, stating, "Our terms say that ChatGPT is not intended for use in the treatment of any health condition and is not a substitute for professional advice." Their safety teams are actively working to reduce risks and encourage users to seek qualified guidance. As AI continues to permeate every aspect of our lives, stories like this serve as stark reminders of its potential pitfalls. The question now is, are we ready to step up and demand better safeguards, or will we let convenience overshadow caution? Share your thoughts in the comments below. Do you think AI can ever truly earn our trust in sensitive areas like health?